What if I told you that in Australia, breaking your arm won't bankrupt you, taking parental leave is actually paid, and going to university won't saddle you with decades of debt? These aren't hypotheticals, they're realities of the Australian tax system that simply don't exist in America. In the next 8 minutes, we'll explore 8 significant tax-funded benefits Australians receive that aren't available in the American system, and more importantly, we'll examine what drives these fundamental differences. If you're curious about how different countries structure their social safety nets, hit subscribe. We break down complex policy differences like this every week. Let's start with the most obvious one, healthcare. Universal healthcare through Medicare. Picture this. A 42-year-old construction worker in Melbourne fractures his wrist on a job site. He walks into a public hospital, receives x-rays, undergoes surgery to set the bone, gets prescribed pain medication, attends 3 follow-up appointments with an orthopedic specialist, and completes 6 weeks of physical therapy. His out-of-pocket cost? $0. Now imagine his American counterpart with the same injury and employer-sponsored health insurance. Between deductibles, copays, and out-of-network specialists, he's looking at $15,000 to $25,000 in medical bills, possibly more if complications arise. This isn't an exaggerated comparison. The Australian Institute of Health and Welfare's 2024 report shows that Australia spends 10.7% of its GDP on healthcare while covering 100% of its citizens. The United States spends 17.8% of GDP, nearly 2/3 more, yet leaves millions uninsured or underinsured. How does Australia fund this? Through a Medicare levy of 2% of taxable income. For someone earning $80,000 annually, that's $1,600 per year for unlimited hospital care, specialists, diagnostic tests, and emergency services. The trade-off is clear: higher base taxation in exchange for the elimination of medical bankruptcy risk. In the U.S., over 530,000 families file for bankruptcy annually due to medical bills, a phenomenon that essentially doesn't exist in Australia. But healthcare is just the beginning. Let's talk about what happens when Australians become parents. Paid parental leave. Meet a couple in Sydney expecting their first child. When their baby arrives, the primary caregiver receives 18 weeks of government-funded paid parental leave at the national minimum wage. That's $812 per week. The secondary caregiver gets an additional 2 weeks. That's 20 weeks combined, or roughly $16,000, paid directly by the government, not dependent on employer generosity. Compare this to American parents who are cobbling together unpaid FMLA leave, if they qualify, with whatever vacation days they've accumulated and short-term disability insurance if they're lucky enough to have it. The OECD's 2023 Family Database confirms what many Americans already know. The United States remains the only developed nation with 0 weeks of federally mandated paid parental leave. The Australian scheme costs roughly $2 billion annually. That's approximately 0.1% of the federal budget. The philosophy here is straightforward. Society benefits when newborns receive parental care during critical early months, and parents shouldn't have to choose between bonding with their child and paying rent. This investment in early childhood continues as Australian kids grow up, particularly when they reach university. HECS help. Income contingent university loans. Consider a medical student graduating from the University of Brisbane with $80,000 in university debt. Sounds crushing, right? But here's what makes the Australian system radically different. She doesn't repay a single dollar until she earns above $51,550 annually. When she does start earning above that threshold, repayment begins at just 1% of her income, automatically deducted through the tax system. The debt is indexed to inflation, not compound interest. If she takes years off to raise children or never ends up earning above the threshold, the debt is eventually written off. She'll never receive collection calls. Her credit score isn't affected. There's no private loan servicer adding fees. The Department of Education's 2024 data shows that 3 million Australians currently hold HECS debt, but because repayment is tied directly to capacity to pay, it functions more like a graduate tax than traditional debt. The average time to full repayment is 8.5 years for those who do repay. Contrast this with U.S. federal student loans charging 6 to 8% interest and requiring immediate repayment 6 months after graduation, regardless of income. American graduates often pay hundreds of dollars monthly while earning barely above minimum wage. The Australian system removes the immediate financial barrier to higher education while ensuring that taxpayers eventually recoup costs from those who benefit economically from their degrees. It's not free university. It's intelligently structured debt that doesn't crush young people at the start of their careers. Education access matters especially when unexpected life events occur, which brings us to income protection. Comprehensive unemployment benefits. Imagine a software developer in Perth who loses her job when her company undergoes restructuring. Within 2 weeks, she begins receiving job-seeker payments. $7.49 per fortnight for singles, more if she has dependents. She also qualifies for rent assistance supplements and gains free access to job placement services through a government network designed to match skills with opportunities. This support continues for up to 12 months while she searches for suitable employment in her field. Services Australia's 2024 figures show about 750,000 Australians currently receive job-seeker benefits. In the United States, unemployment insurance varies drastically by state, averaging 26 weeks maximum and ranging from $235 to $823 per week, depending on where you live. Many states have made qualification increasingly difficult, and the system is designed as temporary emergency relief rather than a genuine transition support mechanism. The Australian approach reflects a different philosophy. Society benefits when unemployed individuals can focus on finding the right job that matches their skills, rather than being forced to take any available position immediately out of financial desperation. This isn't about enabling laziness, it's about efficient labor market matching. But what about those who cannot work at all? Australia's approach here is particularly distinctive. National Disability Insurance Scheme. In Adelaide, a 28-year-old man with cerebral palsy receives an individualized NDIS funding package worth $45,000 annually. This covers his physiotherapy sessions, specialized mobility equipment, home modifications for accessibility, and support workers who help him maintain independent living. With this support, he works part-time in graphic design and lives in his own apartment. The NDIS, launched in 2013, currently supports 610,000 participants at an annual cost of $35.6 billion, according to the 2024 quarterly report. It's comprehensive, individualized, and most importantly, nationwide. Compare this to the American patchwork of state Medicaid waiver programs, where eligibility and services vary dramatically by state, waitlists stretch for years, and strict income limits often force disabled individuals to remain poor to maintain benefits. The tragedy is that many Americans with disabilities who could work with proper support remain institutionalized or dependent because the system doesn't fund the assistance they need. Australia funds the NDIS through a 0.5% Medicare levy increase approved in 2013. The premise is clear. Disability support shouldn't depend on which state you live in or how wealthy your family is. The philosophy of collective support extends even to how Australians approach retirement savings. Superannuation guarantee. Here's something that surprises many Americans. Imagine a retail worker in Queensland earning $55,000 annually. On top of her salary, her employer is legally required to contribute an additional 11.5%. That's $6,325, directly into her retirement superannuation account. She never sees this money in her paycheck. It's deposited directly into her super fund, where it compounds over her career. This isn't optional employer matching that requires employee opt-in. It's mandatory. Every employer must contribute, whether the business has 5 employees or 5,000. The rate is increasing to 12% by 2025. The Australian Taxation Office's 2024 statistics show $3.5 trillion in superannuation assets across the system. Compare this to the United States, where 401k plans are optional, matching is at employer discretion, and 55% of American workers lack access to any employer-sponsored retirement plan. The Australian superannuation guarantee is a forced savings mechanism that removes individual discipline from the equation. It ensures that nearly all workers, regardless of financial literacy or willpower, accumulate retirement assets throughout their careers. The trade-off is less take-home pay flexibility, but the guarantee of retirement security. While we're discussing mandatory contributions, There's another area where Australian tax benefits become immediately tangible. Bulk billing for general practitioner visits. A family in Canberra with 3 young children visits their local GP throughout the year, routine checkups, vaccinations, a bout of strep throat, a sprained ankle, seasonal allergies. They make perhaps 15 visits annually. Because they're doctor bulk bills, meaning the doctor bills Medicare directly, the family pays nothing out of pocket. No co-pays. No deductibles. 0. The Department of Health's 2024 data shows that 74% of GP visits in Australia are bulk billed, meaning they're completely free to the patient. The remaining 26% charge a gap payment, but it's typically modest, maybe $20 to $40 above the Medicare rebate. In America, even with good insurance, a primary care visit averages $129 to $250, plus whatever your deductible and copay structure requires. This cost barrier leads many Americans to delay seeking care until minor issues become serious problems requiring expensive emergency room treatment. The Australian philosophy is preventive. The government calculates that unlimited free GP access reduces expensive emergency room usage and catches serious conditions earlier when they're cheaper to treat. Removing financial barriers to primary care is an investment, not just an expense. Finally, let's examine a benefit that literally keeps medicine affordable. Pharmaceutical Benefits Scheme. In Tasmania, a man with type 1 diabetes walks into a pharmacy with a prescription for insulin. His cost? Maximum $31.60 per prescription for general patients, or $7.70 if he holds a concession card for low income. The same insulin costs Americans $300 to $400 monthly without insurance. And even with insurance, copays can be crushing. This isn't just about insulin. The Pharmaceutical Benefits Scheme lists over 5,000 medications, from common antibiotics to rare cancer treatments. Every medication on the PBS costs patients the same capped amount, regardless of the drug's actual market price. The government negotiates bulk pricing with pharmaceutical companies, caps the patient contribution, and absorbs the remainder. Compare this to the United States, where Medicare was actually prohibited from negotiating drug prices until the Inflation Reduction Act of 2022 began allowing limited negotiation. Americans routinely pay 2 to 3 times what other developed nations pay for identical medications. The PBS demonstrates the bulk purchasing power of a single-payer system. The Australian government, representing 26 million people, can negotiate sustainable prices that individual Americans simply cannot. So what does all this mean? These 8 benefits, universal health care, paid parental leave, income-contingent education loans, comprehensive unemployment support, disability funding, mandatory retirement contributions, free GP visits, and capped prescription costs, share a common thread. They're funded through collective tax pooling and based on the principle that certain risks shouldn't be borne by individuals alone. Here's the surprising part. Australia's effective tax burden is roughly 28% of GDP, while the United States sits at about 27%. That marginal 1 percentage point difference funds a substantially different social contract. Neither system is universally better. That's not how policy works. There are real trade-offs. Australia has longer wait times for elective surgeries. University places are limited. The tax system is less flexible. Americans enjoy lower base tax rates, more consumer choice in healthcare, and a more dynamic labor market in some sectors. The fundamental difference is philosophical. Are healthcare, education, and disability support primarily individual responsibilities, or are they collective investments where society benefits when all members have access? Here's what I want to know. If you could design a hybrid system taking elements from both the Australian and American approaches, which 3 benefits would you prioritize making universal, and which would you leave to individual choice? Share your reasoning in the comments. I'm genuinely curious about diverse perspectives on this. If you found this comparison valuable, subscribe for more deep dives into how different countries tackle universal challenges. Thanks for watching.